Good morning once again, everybody, and welcome to our second video where we are going to be focusing on pathologies of the leg with a short second session on pathologies of the knee. Once again, I would just like to start out by saying that we are not diagnosing or replacing any medical advice given to our clients, but we are merely linking a condition that has been confirmed by a medical practitioner with our Lilian Terry complexes, which are formulated by our doctor who has specialities in pulmonology, pediatrics, and homeopathy. So we're going to start off by looking at deep vein thrombosis. This is most common in the lower leg or in the inside of the thigh. And deep vein thrombosis, that clot can actually break loose and cause a pulmonary embolism, which is why at Lilian Terry with our FlexyCupping, we never ever cup from the knee down, front or back of the leg. The client may have this deep vein thrombosis, not be on any medication for it, not be aware that they have it, and then with the negative pressure of cupping therapy, you can actually aid that this clot dislodges. So what we would suggest then is that you are using our Vascu Flow every morning with the application of Fluidless in the evening if necessary, if there's any associated swelling. Your common symptoms are your warmth or tenderness over the vein. You can experience skin redness, pain, or swelling over the affected part of the body. Moving on to restless leg syndrome, your legs become uncomfortable when lying or sitting. It can be described as a creeping, crawling, tingling, or burning sensation, and your possible causes can actually be anemia, which is why it is often experienced in pregnancy. If it is experienced in pregnancy, we would definitely recommend that you use our Pregny oil. It is safe from conception to postpartum, and you can apply it to any areas where there are problems, including then for your restless leg syndrome. Once again, I would just like to say, as far as cupping goes, we do not do any body cupping in pregnancy, as this is going to take too much blood away from the fetus to the site of where you are cupping. So you would then just use the oil in pregnancy. With regards to other people, it can be made worse by smoking, alcohol, and caffeine consumption. And we would recommend then that you use Vascu Flow in the morning and then use Betta Sleep just on the chest area in the evening to aid a restful sleep. Moving on to varicose veins, as you know, they are swollen, twisted veins that are visible just under the skin, and it is caused by weak or damaged vein valves. The blood can then back up and pool in these veins. I would recommend that you use Vascu Flow every morning. If you are going to go down the surgery route, it is advisable that you use Tramino pre and post-operatively to help with the associated pain, bruising, and possibly swelling. But I would definitely suggest that you complete an entire bottle of Vascu Flow before going down that surgery route. With growing pains, our next condition, although it is called growing pains, there is no evidence that a child's growth is actually painful. It's most likely caused by overuse during the day, which is why it's very common in preschool and school-going children. It's an aching, throbbing pain felt in the front of the thighs, the calves, or behind the knees. I would recommend that you use sports muscle in the evening, followed by Betta Sleep, and then for children 7 and under, lullaby. Apply it to the chest or back area just before they go to sleep. And then you can also use the addition of our children's FlexyCup, which is also our neck cup. And then either cup a bit on the leg with the sports muscles above the knee, or then cup on the back with your sleep complex. This will just aid a good sleep and prevent that pain that can sometimes then wake them up in the middle of the night. The next condition is Shin splints, medial tibial stress syndrome, and this is a painful overuse injury and it occurs inflammation of the muscles, tendons, and bone tissue around your tibia, and the pain is typically on the inner border of your tibia, and it can result from flat feet, which is overpronation of the feet, incorrect fitting or support of footwear, and then lack of warm-up or cool-down stretches, weak ankles, and then hips or core muscle weakness. So I would recommend that you use sports muscles and then also osto. So you could possibly alternate or use sports muscles before exercise and then osto in the evening. And then we won't really indicate cupping for shin splints, as obviously this then is positioned on the lower leg. So just stick to the use of the oil daily. The next condition is iliotibial band syndrome, and this is also an overuse injury where your ITB becomes swollen and irritated, and this is rubbing against the bone of the hip or the knee. And then the ITB is obviously your tendon that runs on the outside of the leg that connects the top of your pelvic bone and then inserts just below the knee. Your causes of your ITB could be poor training habits, poor muscle flexibility, and muscular or mechanical imbalances. For example, leg length discrepancy, abnormal pelvic tilt, or bowed legs, etc. I would recommend for the ITB treatment that you use sports muscles. Obviously, if it has got something to do with the actual pelvis or any problems there, that you can then use Arthro L. And then cupping very definitely indicated along with your sports massage techniques. Muscle cramping. This can be caused by overuse of the muscle, dehydration, muscle strain, or perhaps holding a position for a prolonged period. There could be an underlying cause such as inadequate blood supply, compression of a nerve in your lumbar spine, or mineral depletion. So I would recommend that you are using Vascu Flow in the morning just to get adequate circulation to all of those areas. And then sports muscles pre-sporting events or in the evening, and then back formula can also be then indicated. We would do cupping for this as long as the muscles are then anything above the knee. So you can definitely then use your FlexyCupping just to assist in blood circulation, lymphatic drainage, and just getting rid of any congestion in the tissues. Your muscle strains. This is when there is a stretch or a tear of your muscle fibers. It results in pain and tenderness. Your pain increases when the muscle is moved, and then it is obviously relieved by rest. You have local swelling, and there may be discoloration if it is very bad. It can be graded in a grade 1 muscle strain, where only a few of your muscle fibers have been stretched or torn, all the way through to a grade 3 where the muscle is actually torn through. And then you would definitely be using your Tramino, as this is a major trauma to that muscle tissue. And then progressing more into your secondary phase or subacute phase, where you will indicate massage as well as gentle cupping. And then you can also then apply sports muscles, and then also going forward to prevent any further muscle strains. And then just cup according to the client's pain limitations. That is all for the leg pathology. We will address cellulite in a totally separate little video clip, as this is very much of interest to our clients as well as our therapists, and there will also then be a separate video specifically for cupping to reduce cellulite. So join me next for Pathologies of the Knee.